Can I hold him on
The
the
only
way
thing is for the
home?
disc to fully heal,
Sure.
you think that 10 days after surgery, the disc would be healed.
A little
It
wiggle
takes 6
worm.
weeks for the disc to heal. So, and this place where I've taken out the bone, it's got to heal over with bone. So, you know, if you've got a fracture, it takes at least 6 to 8 weeks.
The bone will
It'll form dense scar tissue. So that's where I say, you know, as he recovers,
Lucky.
it's not fully healed for 6 weeks, and that's why his activity has to be really minimal for 6 weeks. And so, but anyway, what I say is that he comes out, you know, 3 or 4 times a day. You know, he can sit with you all the time on the couch. We just don't want him unsupervised. But you know, you get him out in the morning, he's ready to go out and do his business, and just sort of prop him up on his back legs. I mean, basically just standing against gravity is good for him. I mean, I'm just, you know, lightly holding him here, barely, you know, supporting him. I'm just giving him a little bit of support. I'm just doing this, you know, in the morning, contracting one leg up, switching over to the other side. Now he's working that side, switch him over to the other side. I mean, just gently sort of switching weight back and forth, and then taking him out with a sling to help him, to give him a chance to do his business, or even, like I say, just using the base of his tail to handle, you know, whatever he seems to like. But if he's not directly in your physical arms, or, I mean, he should be either in your arms or in a crate, basically, while he's recovering, because if given the option of doing it on his own, he will drag himself around and hurt himself. And I've had, maybe in the last year, I've had one doctor who had surgery, this was actually last summer. He had surgery in June, was doing better, and then suddenly 3 weeks after surgery stopped doing better and actually got worse. And that was a clue that he blew out seconded. I had to go back to another surgery. So
We're not doing that again.
no, we're not doing that. No. This is hopefully a one-time only thing.
Right.
Most dogs, it is a one-time only thing. I did do the fenestration thing that hopefully minimizes the chance of this happening again. His spinal anatomy is a bit weird. Like, I don't know, it's weird is not very scientific, but if you look at this, I mean, looking at his spine, and then maybe that's a factor as to why this is blue, but look at that. That's one side, the right side. And look at the left side. It's much broad. So he's very asymmetrical. He's got this funny little, you can see it on this side, where this vertebrae decided to form normally on the right side, and on the left side, it's almost like it's trying to cover a rib. Yeah, exactly. And you can sort of feel that on him.
Is that the sticky outy?
Yeah, that's on the left side. Yeah, that's a funny rib. And so I don't know if that part of his spine has abnormal mechanics. So that just means that he's got an area where it has too much motion, and maybe he jumped, he landed, it kind of spasmed or something like that.
So that little sticky outy rib just shouldn't even be there.
It shouldn't be there. No, I mean, basically that's not.
Because I thought maybe it was just a malformed rib that should have grown like more
No,
under.
it's actually,
but
it's not
shouldn't
present.
exist.
It shouldn't even be there. Yeah.
But whenever we go on him, that stuck out that you
Really?
visibly see.
Yeah, he was still a little bit, like, not real underweight, but he didn't have any muscle tone.
Lucky.
No.
He was 8
Hi,
pounds
Bubby.
when they rescued him.
Really? He's a beautiful size. I mean, some doctors
Yeah.
can talk about, you know, to get some weight off of this sausage, but
Honey.
that's fact. No.